Good morning, everyone. On behalf of UNESCO, and also we are very happy to welcome you to this seminar today on reopening schools. We have organized this seminar in collaboration with CARICOM, UNESCO Santiago office, and UNESCO Kingston office, of course. I'm Faryal Khan from UNESCO Kingston office. I'm the new program specialist. In the Caribbean region, as schools in most countries remain closed, efforts are being made to ensure the continuity of learning through alternative modalities. At the same time, countries are now anticipating and preparing for the school reopening. Planning for school reopening needs to be prioritized to assure the safety, protection, and well being of all learners, teachers, educational personnel, and families. And we are going to work very closely in collaboration with health experts and other concerned stakeholders. It is significant to address the readiness of the education system to ensure the continuity of learning and to build system resilience to anticipate and deal with any risks that may be foreseen. So we have with us a very distinguished panel. I'm very happy to introduce Dr. Stephanie Fletcher Larte, who is from CARFA, the Caribbean Health Agency uh, and we have with us representatives from Curacao and also St. Lucia. We are going to start by sharing the framework that UNESCO, World Bank, and UNICEF and the World Food Program developed together to reopen schools. So it's a pleasure to introduce you to Margaret Sachs Israel, our regional advisor from UNICEF for the Latin America and the Caribbean region. She's going to present this global framework, and then we will open up the floor with the panelists. So thank you very much. Would the panelists just like to greet everybody before we begin? So over to you, Margaret Sachs Israel.
Yes, good morning, everyone. It's a great pleasure and an honor to be here today with you for this very important webinar on school reopening. So I will present to you the global framework for reopening schools, which was launched on the 27th of April by UNICEF together with UNESCO, WFP, and the World Bank, and which is based on the latest guidance from WHO.
Thank you, Margaret. We'll invite first the panelists to just introduce themselves, and then you will present the panel. Would that be okay?
Okay, well, sure.
Because we would just like everyone to meet you and the panelists. So we invite Mrs. Susan Larmoni Van Hedorn just to say hello to everybody.
Hello to everybody. I am Susan Larmoni, Policy Director of the Ministry of Education, Curacao.
Thank you so much. And Dr. Fiona Meyer, would you like to introduce yourself?
Hi, everyone. Fiona here out of St. Lucia. I am the Chief Education Officer, and it's a pleasure to be here this morning. Thank you.
Thank you. And Ms. Langchi Zhao from the regional office in Santiago.
Good morning, everyone. Hello, hope everyone is well.
Thank you very much. Thank you. Marguerite Sachs Israel, over to you. Thank you for beginning the presentation. Thank you.
Okay, so I will start. All right, so first of all, I'm Margaret Sachs Israel. I'm the Regional Education Advisor from UNICEF for Latin America and the Caribbean. It's a great pleasure to be here today. So as I started to say, I am here to present to you very briefly the Global Framework for Reopening Schools, which was launched by UNICEF, UNESCO, WFP, and the World Bank. And it's very important to mention also that it's based on the latest guidance by WHO. So what is this framework for? It actually serves to inform the decision-making process of governments on when and how to reopen school. It also supports the national preparation and guide the implementation process. It takes the perspective of ensuring sufficient readiness of the country for reopening, but within its very context specificity. And it provides an overall framework based on which countries are then able to develop their context-specific action plans and to operationalize it at country level. Now, why reopening? So importantly, the framework starts by highlighting that prolonged global school closure presents a very serious risks to children's education, protection, and well-being, and this is well documented through experience made in previous crises, such as the Ebola one. And we also know that it's the most marginalized children who are the hardest hit. The longer vulnerable children out of school, the less likely they are to return. And then we come to the important question, which is when to return. Now, the decision on when and how to return lies with the government and should be based on public health evidence and an analysis of benefits and risks across education, public health, but also socioeconomic factors in the local context, and be always guided by the best interest of every child. How to reopen? Now, in many contexts where schools have reopened, we have seen that school opening may need to be progressive. It could begin in areas with the lowest rates of transmission or take a staggered approach, such as opening just a few days of the week or only for certain grades levels. And it's obviously nuanced according to where people live. For example, reopening will be different in remote rural areas than in urban slums or in highly densely populated areas. As we've seen in countries where reopening began, the process is very contextualized. In China, for example, we've seen that opening started with students in their final year in order to prepare them for university exams, whereas in Denmark and in Norway, opening began at grades 1 to 4 and in regions with low infection rates. Also, what is very important to note is to involve families in the process. In the end, it's families that have to take the decision to send their children back to school, and they need to feel safe about doing so. Now, what should be considered for school reopening? The framework proposes 3 main phases. The first one is planning prior to reopening, then during the reopening process, and then the last one is when schools are actually opened. And for each of the phases, there are 6 main dimensions, starting with policy and financing, then school safe operations, learning, protection and well-being, and then very importantly, equity and ensuring that there's access for the most vulnerable ones. So just a few actions under each of the phases I would like to share with you. So prior to reopening, the system needs to be ready in terms of policies, procedures, and financing, focused on strengthening the system and reforms for better reopening. First and foremost, schools need to be safe. They need to have the conditions and protocols in place that reduce disease transmissions, and teachers, communities, families, and obviously the student himself or herself need to be prepared to mitigate risks. Schools also need to develop strategies to ensure that all students return. This has the focus on the most vulnerable ones. And that can include back to school campaigns and importantly, eliminating barriers to education for the most vulnerable, such as, for example, the revision of admission policies, school fees, as well as offering incentives. Schools will need to plan for supporting learning recovery, as well as for the well-being and protection. And teachers need to be equipped to deal with both learning recovery and students' psychosocial needs. In the second phase, during the reopening process, schools need to ensure safe school operations, promote healthy behavior, and invest in water, sanitation, and hygiene to mitigate risks. Schools need to focus on the compensation of lost instructional time and organize large-scale remedial education. And they also need to identify, before doing so, what are the learning levels and the learning gaps in order to provide adequate catch-up programs. Proactive approaches should be implemented to integrate vulnerable out-of-school children, and importantly, psychosocial support services need to be increased to support children and their families in coping with stress generated by the pandemic. When schools are reopened, it is important to actively monitor health indicators, because there might be situations when schools need to close again and then reopen again, and increase investment in innovative pedagogical approaches, including for remote learning and blended approaches. Lastly, when school reopen, we must not return to business as usual. And that is something that the framework very much emphasizes. We must aim at learning from the crisis and rethinking education systems. The pandemic actually revealed even more the pre-existing weaknesses of the education systems in the region. We know, for example, that before the crisis in the entire Latin American Caribbean region, more than 12 million children were out of school, and a large percentage was not learning the basics. Violence, as we know, is a key challenge in the region, as is inequity, with major gaps between the poorest and the highest quintile, gender, and children with disabilities, as well as ethnic minority groups. So this global disruption should be used as a catalyst for a transformation in education, so that every child learns the skills they need to succeed in life, school, and work. We must ensure that when schools reopen, every child is included and learns. Every child has access to school-based health, hygiene, and nutrition services, and every child has access to the internet. Thank you.
Thank you very much, Margaret. Hello, thank you so much. Your presentation raises some very critical questions. Are the schools well prepared to open? Are there policies in place for teachers and staff safety and well-being? Are the teachers equipped for preventive and control measures? Are school protection services operational in response to safety concerns for students at home and at school? And can parents, teachers, and staff and communities work together to develop local guidance for schools? So we will now, this has been a very interesting presentation. Thank you very much for sharing it. And we would like to open up the floor for the panelists. So Latoya, over to you to introduce the panelists and begin the discussion. Thank you.
Thank you so much. Thank you, Faria. Thank you, Marguerite. Good day, everyone. So it is my pleasure to introduce our panelists. We're going into a discussion now that will focus on what are some of the from a national perspective, what is happening on the ground in the Caribbean. We'll be featuring two of our islands, Curacao, as well as St. Lucia. And then we will go into some promising examples. So we'll be looking a little further afield to look at some of the promising examples from the globe, and that will be shared by our colleague from the UNESCO Regional Bureau's office. So at this time, I would like to introduce our first panelist, who is Ms. Suzanne Larmoni Van Hedarn, who is a policy director at the Ministry of Education, Science, Culture, and Sports in Curacao. Suzanne, as she likes to be called. She started her career as a young professional, and she has worked primarily in the areas of youth leadership. She has a master's degree in business administration, and she has done much work as it relates to building talents and competencies as it relates to young persons within Curacao and further afield. She has years of experience, and she wants to share what has been happening on the ground as it relates to Curacao within this current COVID context, as well as what are the plans afoot to reopen school, and as Margaret mentioned, to ensure that it's not business as usual. I would also like to introduce Dr. Fiona Philip Meyer, who is the Chief Education Officer in the Ministry of Education in St. Lucia. And Dr. Meyer also has quite extensive experience in education with over 30 years in several areas. Dr. Meyer has focused on teaching diverse groups, not only in St. Lucia, but she has worked in other places such as Europe and Asia. So she comes with a wealth of experience. In this context, she'll be sharing with us what's happening on the ground in St. Lucia, just how they're strategizing the plans that are afoot as well, to ensure that learning continues and that it is effective. So I just want to welcome our panelists, thank them again for being agreeing to be a part of this conversation, and turn over to Suzanne, who will take us through. Thank you, Suzanne.
Okay, thank you very much. Good morning to everyone once again. It is a pleasure for me to share our experience and information on the preparations we were doing for the school reopening in Curacao. We have a big challenge because our education system before COVID-19, we had our challenges, and our key challenges were things that we were working on, but that we have not yet reach the goals with regards to those aspects. For example, we had a very low early childhood participation. We are tied to the Dutch education system and not sufficiently adapted to our local context. We had a mismatch in the proficiencies of the labor market, and we lack diversification in our lower levels of vocational education. But besides, or even with those challenges, after the school lockdown and the school were closed, this was announced at on the 16th of March. We started, as the lockdown was announced, with meetings with all our stakeholders to see in what way we could prepare for the reopening. The first thing that we did was we installed a crisis team. This was installed by our government with representatives of all our sectors. For example, the Ministry of Health and Environment and Nature was the one who was guiding this crisis team. We had an epidemiologist who was steering the process, and the Prime Minister was the one who was responsible for all the decision making that this crisis team had come to. And another very important aspect of this crisis team was that on a daily basis, we made sure that information was passed on to the whole community on the current situation, and data was spread about how the infections and that and everything was going on. We also started after 2 weeks with weekly meetings with all our school boards in order to get information on what the school boards and teachers are doing to continue with the education process. See, see. Okay, eso say.
Yes.
Yes. I forgot I had to share screen with you. Yes, just a minute.
Yes.
Okay. Aquí na? Aquí?
Thank you, Suzanne.
Yes, share
I had
screen.
sent you a little note. Yes.
Okay. Um, aquí. Okay. Yes, share.
Yes.
Una. Aquí. Yes.
There you
Okay.
are.
Those.
Wonderful.
Yes. Is it shared now? It's shared,
Yes,
huh?
it is. Yes, it is, Suzanne. Thank you.
Yes. Okay. Yes.
Click.
Yes.
Yes.
So yes, that's where we were. I already introduced the process. We installed our crisis team with the Prime Minister, who was the head of the crisis team. We started with weekly meetings with our school boards in order to get information on and data on the continuation of the education process, and to see which are the children that were left behind. And we already saw that the education process was it was minimal. The amount of children who had contact with teacher or with schools, it was about 30 to 40% of children and students who had contact with their teachers. We also started an educational TV program for primary education, and we prepared a survey to get much more accurate data and information on the number of pupils and students that were not able to receive distant education and that didn't have um, um, or a device or possibility to have internet in order to have contact with their school or their teachers. After that, we started with a timeline preparation to reopen again, because we saw that we couldn't continue the infections. They were like in control, and we know that we were able, or that we were going to start in a couple of weeks. So the lockdown was partially lifted in the beginning of May, and we know that we were going to start at mid-May with reopening. So what we did is we started with preparation to reopen first the early child care centers. So parents can go to work and start working regularly, and some of the teacher and the child care center leaders could start also taking care of our children. After that, we formulated a ministerial regulation to skip our central exams, because we know those weren't, we couldn't reach the dates. So we skipped the central exams, and we told all the school boards that we were going to do with the school exams as the how you call it? The examination criteria, in order to give the children either their certification or their diplomas. So, and in during that period, we also start with the development of protocols on safety, on logistics, on the way the learning process has to be organized in order to give the children, when they start, a safety environment, and to take care of the hygiene and the well-being of our children. We made a note on distant learning also, but this was geared to 2 schools only. Now we saw this as an opportunity to start with a policy on distant learning in order to make this possible for all our school boards. I'm now going to pass through our timeline preparations for the school reopening. So
Yes.
we started with the preparation, with the protocols and on education and the protocols on the logistics, on the hygiene and things like that from the beginning of May. After that, we made a definitive list of all the facilities that were required. We made a plan for an adapted curriculum per school board, and we start screening students on the area of special education. After that, we organized information sessions for school representatives and for the school transporters in order to prepare them for the school reopening. Via a foundation, we made sure that those schools are going to get the possibility to prepare for incidental things that could happen, and to also give the funding to those schools who needed this in order to install, for example, hygiene products, in order to buy material, in order to do all the things that they need to do, which they don't have enough or sufficient financial means for them. Besides that, we also prepare to start in certain phases. Yeah, we didn't start with all the schools and all the children. We started with the exam classes, and those are in our education system. Of all the 54 facilities that we have, those exam classes started in about 8 facilities. So that was the way we could control all the safety requirements, the hygiene requirements, and the organization of the bringing and picking up the children. Um, I think we are going to prepare to start with primary education at the 1st of June. And after that, we can start with the remaining educational types. The secondary education, we also start on May 18th with higher education system, because those kids or students are much more aware and conscious of the social distancing, of the physical distancing, and you can start with them, and you have those students in control. I think in June, in the end of June, we can have the results of our final exams, and we can retake final exams also on secondary level, and at the beginning of July we can evaluate and adapt the education programs that we are going to start with after the summer vacation. We are also organizing summer programs for different students, and in August, instead of starting the school year on the 10th of August, on which by law it is accorded to start, we are trying to start a bit earlier in August in order to prepare much better for the new school year, that is the school year 2021. I think that we have some challenges. We have some challenges because during everything we were planning, I think that we put a lot of attention at the organizational, at the logistic, and the healthy aspect of the preparation. I think we have to put much more attention on the social, emotional, and the pedagogical aspect of education. I think we are not balanced in that on that aspect. Um, um, we need much more budget for to take care of all the material that is needed. And I think the communication with the school boards, with the union, with all the stakeholders has to be much more regular. I think the proposed framework is okay. I think we can learn a lot of it, but we only have to adapt it to our local situation.
Thank you, Ms. Larmoni. We appreciate your presentation. It was very
You too.
informative. This is
Yes.
Lucette Montgomery from the UNESCO Kingston office. How are you doing? Um, thank you so much. Go ahead, Latoya.
Yes. Hello.
Stop here. I have to stop here. Yes.
Wonderful. Wonderful. Thank you so much. Thank you
Yes.
so much. Thank you. So Lucette did give the thanks, and Suzanne, we want to thank you for just being so prescriptive about what it is that you are doing. You know, very detailed. We could see that clearly. I want to thank you. We want to turn over now to Fiona, who will be sharing what has been happening from St. Lucia. Thank you. And just a reminder that, you know, we're trying to, as much as possible, to keep the time on the 10 minutes. So we thank you for that. And we also want to share too that the discussions, we are seeing some questions coming up in the Q&A. So we want to reiterate, please share your questions there. We will answer in the chat, as well as we will also have an opportunity to share some of your questions in the preceding discussions. So thank you for that. I see that Suzanne is online and her presentation is up. Fiona, sorry, over to you, Fiona.
Good morning, everyone, and thank you so much for the opportunity. Representing St. Lucia in the capacity of Chief Education Officer, just to give you an overview as to what's happening. As of March 16th, we closed all of our schools in the physical sense, and that was 2 weeks prior to the Easter break. Thereafter, for the third term, we started a blended approach in various schools, the use of virtual online studies, as well as paper-based studies, the use of teletutorials, radio stations. So this is where we have been. As we contemplate the safe reopening of schools, for us, we're looking at a couple things that are very, very significant. The major one for us is the guidance of the Chief Medical Officer in and under the leadership of the Ministry of Health. So everything that we do, we liaise quite closely with that team. We have sought to engage major stakeholders, and I'm very happy that we were able to engage some students as well, because sometimes their voices do not get heard. Mostly the adults are speaking about what should happen for them and to them. So we've had major stakeholder engagement, including the union, administrators, parents, teachers, and as I said earlier, students as well. A lot of what guides our reopening has been data-driven, has been surveys to see what's happening on the ground, in addition to the medical advice that we've received. So one of the things that we have done, we have reconsidered our local examinations. That would be our grade 2 and grade 4, which would have been diagnostic testing. So that has been canceled for this year. We have sought to engage also through COSOD and to identify the regional positions that CXC, and so a lot of our CXC data is guided by the COSOD decision. Health and safety protocols cannot be spoken of enough, and we always look to Ministry of Health to support us in that. Earlier on, somebody spoke about it, the sanitization of schools remain a major concern And so we have moved very swiftly to bring about this in a very practical way by the training of our support staff and also schedules of cleaning at the schools. Perceived limitations. What are our challenges? As in everything, you know, the fact that COVID is here, although we're told quite often that we have to live with it, but we appreciate that many people are anxious, families are anxious, various economic situations and issues are coming up, so there's lots of anxiety. Students with health issues, how best to support them. Parents are concerned about the cleanliness of the schools, although we have tried our best to support, but that's still a concern. Adequate engagement with teachers so that they are aware. So in as much as we do, you know, Zoom meetings where we speak to various districts, parents, teachers, principals to really explain why the proposal to reopen. The psychosocial and the counseling of staff and students is a direct result of the anxious and anxiety that is felt overall. For us in St. Lucia, we're going through a bit of a drought. So the use of water resources, as we speak of COVID, you know, the cleanliness, the hygiene. So we have done our best to bring in the water personnel to ensure that we have those resources available. The use of masks, the use of cloth mask has continued to be a major topic of discussion for many of our parents, many of our teachers, and likewise, we have sought the engagement of Ministry of Health in order to do so. What is our strategy? Our strategy as a Department of Education, Innovation, General Relations is a phased approach. As compared to Curacao, we're looking specifically at our grade 6 students and our Form 5. These are our two major examination and assessment periods. And we felt that under the guidance of the Ministry of Health, we were able to propose a reopening of school. I must also say to this esteemed grouping that we continue to wait on the Ministry of Health, because persons ask what would trigger, you know, abortment, so to speak, of the plan. It would be Ministry of Health. At the moment in St. Lucia, we are very happy that we have now 0 confirmed cases. We were at 18 in total with a couple imported cases, but all of our 18 confirmed cases have recovered. So we have 0 persons hospitalized, and we are very pleased and happy for that. It doesn't mean we're out of the woods, risk still exists, but we continue to engage Ministry of Health in that regard. So to the specifics, we're looking at June 2nd. We're looking at a 4-day cycle, a Monday to Thursday, sorry, with a 9 a.m. to 11 a.m. or to 1, sorry. So let's say that again. June 2nd, proposed date, Monday through to Thursday, and a 9 to 1 p.m. daily. And as I said earlier, we've continued to engage to really make sure everybody's on board. Significant to us, water, the school feeding provisions, transportation, effective use of masks, and counseling services remain very important as we look at our strategy. I needed to just give you a brief overview as to who we have. In St. Lucia, we have 74 primary schools, 24 secondary schools. In our early childhood sector makes up about 100 early childhood centers, some of them government as well as private. So these are our figures. For CSEC, we're looking at over 2,400 students. We have our CAPE students just under 500. Our CCSLC students, 113. And our common entrance is our grade 6 students. We have 2,198. And it is because of those numbers that we really felt it important to liaise with Ministry of Health so as to bring the students back to the physical classroom, because we're keenly aware that we have discrepancies, there is inequality, families can access and others really cannot. So it was important to bring them back to the physical building in a safe environment, in a sanitized area, in an area where we can provide support to the students. So these are the numbers that reflect families and lives that we're trying to really support and ensure that the end of this primary school, as well as the end of their secondary, and as well as the A-levels into CAPE, are done as best as we can. What are our strengths? Strengths, we have appreciated that COVID has pushed some of our teachers a little bit, has encouraged parents to be more vigilant, to be more aware as to what their children are doing. So the e-learning strategies, we want to see them not as a COVID response, but as a more long-term involvement. And we know that we've reached children that we would normally not have. So it's important to look at this. We recognize the inequality. And so how best do we work at it to make it better? The need for improved training of our teachers. Sometimes we train our teachers, but there's not implementation, there's not retooling and upskilling. So it's important to go back and to, bring that, tease that out of them, support them as they go along. So that's very, very important. We have our psychosocial, we have a return to happiness program and the UNICEF, child and the child safety and the school, safe school zones would appreciate the return to happiness for our students. Psychosocial interventions, as well as the resilience of our staff, students, parents, these are major opportunities and strengths that we hope we can build on as we move into the new academic year of September, hopefully, if we get the advice of the Ministry of Health, where we can bring aboard all of our students. Thank you so very much.
Thank you so much, Fiona. Really appreciate it. Thank you. We will now go into our segment that speaks to promising practices. So we will now turn over to Lanky, who will be taking us through that about what's happening in other places. And then we'll have an opportunity to quickly get some shares or feedback, questions, answer some questions as it relates to these particular national perspectives that have been shared. Thank you. Lanky, over to you.
Yes, thank you so much, Latoya. So my name is Lan Qi. I'm from UNESCO Santiago office. And today I have the pleasure to share with you some of the promising examples from all over the world. So UNESCO headquarters organized a global webinar a few weeks ago under the topic of a safe return to school, where several country examples were presented. And based on these country examples, today I'm sharing with you the four country examples, namely Denmark, China, Mexico, and Sierra Leone. And at the end of the presentation, some lessons learned will be summarized for us to take away and reflect on after the webinar. So the first country we're looking at is Denmark. It is the first country in Europe to reopen school on the 15th of April. And as mentioned shortly by Margaret at the beginning of the webinar, the first ones that went back to school are the younger ones. And how Denmark is preparing for school reopening is based on the strong cooperation between three parties. They are the Ministry of Children and Education, the health authorities, and schools and the institutions themselves. So the Ministry of Children and Education published guidelines on the safety return to school prior to the reopening. On the right side in the blue color, we can see some of the main features for the guidelines. So the guidelines gave detailed instruction on how to keep distance within classroom, which should be at least 2 meters among students, and frequent hand washing at least every second hour was encouraged. Frequent cleaning of educational facilities are requested. Also, to avoid physical contact and minimize the socialization among pupils was required. Also, there should be no sharing of food. At the same time, the ministry also established a hotline for general queries and a Q&A website, as well as a counseling service available for the public throughout the implementation process. At the same time, the health authorities also developed a range of supporting tools, including films, inspirational materials, and explanation materials for activities outside, posters, letters, and a hotline. And according to the Ministry of Education in Finland, the most important is for schools and institutions to self-discipline and oblige themselves to remain closed until they can fully meet the health requirements. The second country we're looking at is China. Starting April, different provinces started opening schools on different paces based on their COVID-19 situation. And it's anticipated that by the end of May, up to 200 million students will be back to school, which is a relatively large student population. So how China is managing returning to school with this huge student population is also based on a multi-level cooperation among the government, the schools, and teachers themselves. So it's government's responsibility to ensure the supplies of sanitizing equipment for schools, including masks, disinfectant alcohol, gloves, etc. While CDC, the Center for Disease Control, prepared COVID-19 prevention materials as the first class back to school for students at all levels. At the same time, schools focus their efforts on reducing student density in campus. Measures include distancing within classroom, as we can see on the top right on the picture. This little girl is wearing a DIY hat of which measures exactly for 1 meter, so to give young students a sense of distance. Other measures include taking shifts to study, arranging breaks and meals on different paces, and monitoring the body temperature of students and educational personnel. Also, it's very important in order to continue learning and quality learning, it's necessary for teachers to assess and evaluate the distance learning results and adjust their teaching plans accordingly. And Mexico is right in the process of reopening their schools. They're preparing for a national reopening on the 1st of June. And their strategy take priority on students' well-being. As we can see here, it's a threefold strategy. So during the first week upon the return, social emotional support will be the focus. So teachers will discuss with students about how their experiences are during the pandemic, how the pandemic was experienced, and what are their students' expectations from school, what kind of support they need. And in a slightly longer period, during the first 6 weeks upon return, teachers need to develop a learning recovery plan based on their diagnosis of the distance learning results, while the Ministry of Public Education will be there to deliver special training for teachers on this respect. As for assessment and evaluation, it's also important for assessment to be flexible and put students' well-being at the forefront, while also aiming to ensure fundamental learning actually take place and the successful completion of the school year. Finally, we're looking at Sierra Leone. They have much experience during the Ebola crisis, during which the schools were closed for 9 months. A crisis responding task force was formalized, consisting of Ministry of Education, development partners, and NGOs, while they worked on distance learning, strong social mobilization, and teacher training. Here we can see 2 columns. On the left side is some out-of-school intervention, including offering health guidelines and protocols for safety in school, awareness raising in communities, waiving school fees, and providing school meals for all primary school pupils. On the right side, we see the in-school strategies, which include the hygiene measures, cleaning and disinfecting, hand washing, psychological support, as well as readjusting the academic year. So to wrap up, here are some learning points that we have summarized for based on the practices we have seen so far. So the first point is to plan together. We have seen very strong coordination from the all four country cases. It is important to have coordination and wide consultation among ministries, health authorities, and also to gain support from parents and teachers. The second point is to prepare well, which means guidelines, supporting resources should be at place prior to the reopening. And if necessary, a mock drill could be applied. The third point is to implement and enforce health, hygiene, sanitation measures. As we have seen, they include disinfecting schools, hand washing, body temperature monitoring, etc. And last but not least, we have to resume learning in a gradual and creative way. As we have seen that distancing of pupils in campus has been a major concern for many countries in the Caribbean region. So here are some ways we may experiment, which include splitting students into smaller groups, avoid them touching each other, avoid them from sharing food, and taking shifts of learning. Also, it's necessary to adjust curriculum and the way of a plan and examination throughout the school year, and make psychosocial support available at all times. Last point is something that maybe we can take from this whole COVID-19 crisis is a blended way of learning. How we can maximize the learning outcome with a combination of distance learning and face-to-face learning is the inspiration that we can take from this COVID-19 crisis. So thank you very much. And back to you, Latoya.
Thank you, Lanky. Thank you so much. Colleagues, thank you so much. I mean, so much has been shared, and I know that we are watching our time. There's just never enough time for these types of presentations. I see all the presenters trying to go as quickly as they can while giving us all the information that we need. Let me just say that we did have a brief initial reaction segment, but I think in the interest of time, I will ask Dr. Khan to introduce and to go over to CARFA so we can have that presentation, and then we'll have the full discussion segment following CARFA's presentation. Let me also say that there are several questions coming in the chat, and we're making note of that. We will try to highlight as much as possible what is being shared. And of course, all presentations will be shared and all links will be shared. And some things we may have to answer afterwards and send it out to the wider group. So over to you, Dr. Khan.
Thank you. So Latoya, we are going to then have the joint discussion at the end. That's fine.
Yes, yes.
I would like to thank the presenters for their excellent, very granular detail and, sharing the examples from your specific countries, but also the global perspective from the regional office. And now it is really my pleasure to introduce Dr. Stephanie Fletcher-Larthe. She's a biopreparedness epidemiologist who currently works to lead the Health Information Communicable Diseases and Emergency Response Unit at CARFA, which is the Caribbean, I have to get this right,
Yes,
the
Caribbean Public Health Agency.
The Caribbean Public Health Agency,
yes.
Absolutely. And she has worked extensively in building capacities of systems across Australia, the Pacific Island countries, and the Caribbean. And today we would really look forward to listening to you that as our schools in the Caribbean prepare to reopen after this crisis and emergency situation, what guidelines would you offer us, Dr. Stephanie? So over to you. Thank you.
Thank you so much, Fariel, and thanks to the organizers for the privilege to present to you on such a very important topic today. I recognize that many of the things that have been discussed are so pertinent to the role of CARFA you know, the Caribbean Public Health Agency has a very important role in providing evidence-based guidance to our member states throughout this pandemic. And it is our responsibility to ensure that, you know, we provide the best guidance to them as they respond and prepare for the various phases and stages of this pandemic. As we begin to plan to reopen our schools, there are some very important and fundamental considerations that we need to bear in mind. And the overarching goal and the overarching aim of what we are doing would be to ensure that our students and our teachers and staff remain safe at school. And so it would be important that we, while we are considering reopening, that there are some really important objectives that we would want to achieve. And we are so grateful to UNICEF and the team that have prepared this beautiful framework that we have often drawn reference to. Now, some key areas that would need to be in place upfront is to ensure that the school should be assessed prior to opening to ensure that schools are actually able to meet these standards or minimum standards that are necessary for reopening to preserve the life and the health and well-being of the students and the staff. So some key considerations up front would be to ensure that premises and facilities are regularly cleaned and disinfected, and that there is a capacity to do this, that there are adequate facilities and supplies for hygiene practices, and to ensure that safe distance can be maintained between the students and other students, as well as between students and teachers and staff, that there are procedures in place to be able to identify unwell students and staff, and that these students and staff would be able to follow the advice that has been given by the public health departments, and that once ill staff and students have been identified, that there are adequate procedures in place to direct them to what needs to be done, but also to be able to assess the role of class suspension or closures. Under what circumstances would these things need to be done? Should there be a case detected, or should there be a reintroduction of disease in the local community? So I just want to go through some of what we believe would be some key considerations, and I would love to say that these are very well outlined in the UNICEF's framework for reopening of schools. So in terms of, I believe several of our speakers today have already spoken about the staged approach, and I really did enjoy the presentations coming from the member states on how they have planned and prepared, and also on those lessons that have been learned from Mexico and Denmark and Sierra Leone and China. And I think one of the common thread that I've seen so far is that staging and phasing of the reopening process. It would really be important to have this phase process to give an opportunity for the school to be able to assess how did we go with this phased and staged approach? How well did we manage, and how can we advance to other stages, or how much more can we do in order to protect our staff and our students, but at the same time, recognizing the need to return to some sense of normalcy for our students and our communities. The next thing would be to ensure that we have clear and easy to understand protocols in place. And these protocols would be important to identify what kind of social distancing measures would need to be implemented. How would we be able to prohibit certain activities such as mass gatherings or large gatherings? And I'm thinking, as I say this, in terms of, you know, in school settings, children need to play. How will we manage the need for play while at the same time limiting the risk of infection passing from person to person in that school environment? It would also be important to recognize the need for the physical activity as well as the feeding. How would we be able to stagger that time for lunch breaks or recess? How are things like these going to be considered? And also, how would the space that is available be used based on the numbers of students and the needs for separation of students by age groups, by developmental stages? How will issues like these be managed in a school environment? And also, how will outdoor spaces be used, considering that what we're dealing with is a respiratory type illness? It would be really important to take advantage of the open spaces as much as possible, but also putting in some risk management in place to mitigate against any negative impacts from the use of these spaces. It would also be really important to implement policies to protect staff and students who may be at higher risk, all these vulnerable people. And I believe that this pandemic has really identified a lot of the disparities that exist in the systems, not just in education, but across multiple systems, that those with the vulnerabilities tend to become more vulnerable, and the risk for them are significantly increased in environments like this. And so how would we be able to protect these people who are more vulnerable and those who are at higher risk based on whether they have underlying medical conditions, maybe they have developmental disorders, maybe they are more vulnerable due to their age. And this does not necessarily relate only to students, but also to staff who may be at advanced age, they may be more vulnerable. And so what procedures would need to be put in place to ensure that we are protecting the most vulnerable in the school community. We also need to consider the protocols about the hygiene measures. And this one is really very close to my heart. You know, I have worked in the past as an environmental health officer, and one of my roles used to be to inspect the schools, especially at this time of the year in the Caribbean, when we used to do the assessments for the shelters. And I will speak a little bit more about that component in the next point. But one of the things that we as a Caribbean would be very familiar with is the lack of water in some areas, the shortage. A lot of communities do not have piped water, so they have used water tanks. There is a lot of our schools still have pit latrines. Are we going to have adequate hand washing facilities? Will we have enough water bases or pipes or taps so students are able to wash their hands frequently? You know, some of the examples coming out of the more developed settings like Denmark showed how students were able to stop and wash their hands every other hour. Will we be able to do that in the Caribbean? And if that is necessary, what kinds of plans can we put in place to ensure that students are able to comply with the hygiene measures and that we're not placing them at a disadvantage because we do not have enough supplies to encourage them to wash their hands, to make sure that after using the toilets that they can safely, you know, return to class and so on and so forth. It's really important for us to speak about the context of the Caribbean, considering where we are and some of the issues that we already know that are pre-existing even before COVID-19, and also making accommodation for individual circumstances where these are necessary. And the next point would be to revise our policies and our procedures for using our school facilities during emergencies, for mass gatherings. I know not just in the Caribbean, but in many settings that our school facilities are often used as communal facilities during the weekends for extracurricular activities. The school facilities are often quite useful because of the space. They've got large rooms, they've got large outdoor spaces, they've already got facilities, and they are often used for many types of events or activities. As I mentioned earlier, I know that many of our public schools are used as disaster shelters. I used to inspect the disaster shelters years ago, and some of the challenges that surround those, how once these need to be used in the community, and how we would be able to revise these policies around how these need to be used, and considering that students will need to interact with these facilities. And just in closing, CARFA has developed various resources for our stakeholders, and a few of them I would love to point out to the educational sector is our policy on the use of masks, and we also have a policy on water, sanitation, and hygiene that might be very useful in terms of an institutional setting on things that need to be considered, how you can do the water and sanitation and hygiene in terms of preparing for reopening. And there are various other resources available on our website. And I want to close with this letter that I saw in an online post from a student who was preparing for CXC that really struck me. And this is one area that this pandemic has really highlighted for us. And I just wanted to highlight a few things. And this is mainly to do with the psychosocial and mental health of students. This pandemic has had such a significant impact upon everyone. And I think to a great extent, we may not have really thought about it, how it has impacted on our students. And this young person was writing to speak about how the pandemic had impacted them. And this person spends long hours looking at the daily graphs, looking at how the disease is tracking. And this person then comes and says they would love to return to normalcy, but they think this is folly, and they think it is a risk to their health and their very well-being. And it will be really important that as we move forward to prepare for reopening, that we really consider how this pandemic has impacted upon the community, our youth, our students, and also to put into place measures to assist them to assimilate back into some kind of routine while preserving their mental health. I thank you so much for the privilege to share, and I will remain available for some questions. Thank you.
Thank you so much, Dr. Stephanie. First of all, thank you for sharing all your guidelines, very, very detailed, but also for sharing the voices of the youth. This young student whose letter you have shared is really spot on, because in the absence of a vaccine, we really need to be cautious of how we, what are the risks we are taking, and we need to be fully aware of them. So thank you very much for your presentation. UNESCO, yes, I mean, UNESCO is very keen to provide evidence-based guidance to schools to prepare for reopening. And we are very pleased that UNESCO, UNICEF, the World Bank, and the World Food Program together were able to develop these frameworks for reopening schools, which are, and I'm really glad you are using those and referring to those materials and guidelines. It's important that as we develop clear and user-friendly protocols on hygiene measures, use of school facilities, social distancing, and protecting staff and learners, we keep equity issues at the heart, and keeping not just looking at just hygiene, but also the psychosocial interventions, the resilience of staff and teachers. So it's a high call. And the panelists, the presentations of our colleague Margaret from UNICEF, and Dr. Fiona Myers and Susan Larmoni and yourself, this has been really helpful. And Lanchi, thank you very much for sharing the global perspective, because we have some very good examples, and also draw from what happened with Ebola and learn from the example of Ebola to prepare ourselves well. So let us open up the floor now for questions and answers. Latoya, do you see any pressing questions that we should be looking at now and pose to the panelists?
Yes, thank you, Farial. Thank you so much. And I just for the panelists as well, if you while you're listening, and if you check in the Zoom web chat, I have shared some questions with you privately. So some questions, the questions are around just for further details. For St. Lucia, there was a question about what are some of the strategies that you are now planning or to ensure that there's teacher professional development support for the reopening. You did say it's not business as usual. Specifically, what are you thinking of doing around ensuring that the teachers have the competence and the capacity to do what they need to do? And I'll just jump across to Curacao as well. Again, they're asking now for the parents, what are you thinking of when it comes on to collaborating with the relevant stakeholders such as parents and communities? So we'll start with those two questions, and for the panelists, I'm inviting you to look in the chat.
Over to the panelists, would you like to share from your country examples, and also UNICEF? And I mean, would you like, who would like to go first?
I don't Fiona here.
Yes,
yeah?
Please.
Yes. The specific question is about training for teachers. We had done training. In fact, e-learning has been around. I would always argue that my first experience with Google Classrooms would have been almost 8 or 9 years ago when initial training happened in St. Lucia. So we continue to do so. We appreciated that because of COVID, we did some extra training at the start of the online services and online engagement and learning. But at the moment, it's interesting that up to yesterday, I spoke to my head of ICT integration to really bring back, how best can we help teachers as they implement? Because we know that if while you're learning, you've learned something along the way, we need a bit of a hand-holding, a bit of upskilling. So even as of next week, we have webinars planned for the use of Moodle, for the use of Google Classrooms. We've got Microsoft Teams in a big way in our primary schools. So that is ongoing to give teachers the relative support that they need as they implement. Thank you.
Thank you very much. Suzanne, would you like to respond to some of the questions?
Yes, with regards to the strategies for teachers, I think as I said, we have focused a lot on the hygiene and organizational aspects for the reopening, but we are now preparing a training program for teachers in order to prepare them for guiding the students and children in the social emotional aspect, because I think that we were a little bit too much on the side of the organizational and safety and hygiene aspects and a bit too little on that aspect. So now we are going to prepare a training for those teachers on those aspects, on the social emotional, on the pedagogical aspect for the reopening. Another question was about the collaboration with relevant stakeholders, for example, parents. We are now executing a survey in which we really want to know what parents felt during the period, what was lacking, and how we can help them in the problems they're facing with regards to this whole problem of COVID-19, the lockdown, the reopening, etc. So in that survey, we are going to get the data and information that we need in order to sustain parents and students, because the survey is directed on parents, on students, and teachers. So when we get all the evaluation forms back, we have a better view on which aspect and areas we have to give support, help, and sustainment.
Thank you so much. Stephanie, would you like to, Dr. Stephanie, would you like to respond to some of the queries?
Yes, I was taking note of the one that speaks to strategies to manage safety and hygiene. Now, where these are not currently in existence, your local Ministry of Health may have some strategies. However, this is one area that CARFA may be able to assist with in terms of providing a more generic safety protocol that schools could tailor to their individual needs. So we can look into that and work with UNICEF to see whether we can get something done in that area. The other area that I know I would love to contribute to is one question that asks, do you have a pool of teachers that are ready if they get sick? Now, while I cannot answer on behalf of the Ministry of Education, when we in public health, when we do pandemic planning, we speak about something called surge capacity. And this applies not just to health facilities, but to any kind of organization. So it would be really important to have a surge, a backup, that in the event that staff would get sick, that there is a group of backup teachers or other staff members that are able to cover for those who are ill, to ensure that there's continuity, and also for the mental well-being, because some teachers may begin to worry that I can't go to school and feel pressured that they must come to school even while they are ill. And this is one of the ways in which the disease will continue to spread from person to person. So it is really important that that unnecessary pressure is taken off those teachers. I know how committed teachers are, and they usually feel this great sense of responsibility to their students. And so it's important that they feel supported while they're ill, that they are able to safely take sick leave so that their classes will be looked after going forward. Thank you.
Thank you so much. While we are on the issue of health, I would like to mention that the WHO, the World Health Organization, has also developed some guidelines and considerations for school-related public health measures in the context of COVID-19. And in response to some of the questions, I would like to just share. We will put these. We will make these available online and share the link with chat as well. But WHO suggests that decision makers should look at they should have a current understanding about COVID-19 transmission and in their local communities, and they should understand how it affects children. The local situation and epidemiology of COVID-19, where the schools are located, must be fully understood, and the school setting and ability to maintain COVID-19 prevention and control measures should be considered. They also they tell us a little bit about some points that need to be considered as we look at the local situation, and also monitoring schools after they reopen, because you know there are questions about the effectiveness of tele-schooling interventions and how well the school has been able to develop tele-schooling strategies. What are the proportions of children that were reached? And also to keep open up feedback from parents, teachers, and learners on how things are progressing. So to keep those feedback loops open. Now, once schools reopen, it's going to be very critical. And of course, we will share these guidelines with you, but I wanted to share with you that there's a whole plethora of protocols that have been developed at country level, promising practices. So Lanchi, our colleague from the Santiago regional office, would you like to share some of the work that UNESCO Santiago office is doing in this respect, and maybe share some thoughts in response to the questions asked by our colleagues, by our participants?
Well, thank you, Faryab. So regarding what UNESCO Santiago office has been doing, we have been posting constantly in the chat section about for the dedicated website of our office on COVID-19 response. So just in a short now, so our office has developed a regional response strategy towards COVID-19, which is aligned with the UNESCO headquarters global strategy. They can be found online and also on the website. So on that point, I think we should focus on the reopening strategies. I think I have seen many questions regarding if students should wear a mask in the school. According to the Chinese experience and also the global experience, it's not necessary. Like in Finland, they're not doing that. But in China, we are. I think it depends a lot on the local situation. And how prepared school is to provide students a secure environment. Can you please remind me if there are other questions?
Farial, if I may, and Lanky, thank you. Farial, if I may, just to flag that there was a question, perhaps it's not for Lanky necessarily, but open to anybody else about to bring Margaret in after Lanky on strategies for screening and closing learning gaps, as well as the whole issue of the local adaptation in the framework. So you spoke about screening and as well as local adaptation in the framework. And that's a question for Margaret.
Is Margaret there? I'm not sure if Margaret is there. So would anybody on the panel like to take that question?
I think Margaret's microphone is not working, so.
Okay. Latoya, if you repeat the question, I'll just try to see how we can answer it best.
Thank you so much. So the question is around just the learning gaps. How do we make sure, what are sharing some of the strategies, what will be done as it relates to screening the students in order to be able to close the learning gaps, which would have widened during this time. I think I see Suzanne's hands going up. Yes.
Yeah. Yes, what we are trying to do is, that's why I ended my presentation with trying to start the next year program a bit earlier in order to have a better view of the start situation of the children. And when you have that, you can prepare the program for that school year in order to get to the children who are arrear. You can help them. So, and another aspect is, so see to it that the vacations that are programmed during the whole school year can be shortened in order to get some more days to prepare the children. The vacation, you can, we are also thinking about programs during those vacations, because during the whole school year, you have a vacation in October, you have another in December, and then you have the next year in April, you have the other vacation. So if all those vacation can be shortened, and you can, you will have more days to give education and to look at the children who are arrears. So that's what we are trying to do. Either summer or vacation programs, and also to lessen the vacation days of the coming school year.
Absolutely. So I think this is a very pertinent question about the learning gap. And our research does tell us that, even under normal circumstances, when children go to school, there is loss to learning. And by the time they return to school, they are already lagging behind. And there are projections currently that are being carried out that are assessing that under the COVID circumstances and the uncertainty of the protracted closure of schools, there is going to be loss to learning. and we need to prepare for very carefully to mitigate that loss, as you mentioned just now, through catch-up sessions over the summers, but also especially when it comes to high school and learners who will need to be taking exams and preparing for examinations. They would need to be extra support given to those students to, to help them cope with, the COVID situation, but then having to prepare for exams that on which their, life opportunities depend. So there are different measures that are, and UNESCO is working, has offered to member states in the Caribbean that if you would like support with planning for some of these risks to mitigate the impact of COVID-19, we stand ready to work with the governments, and based on each specific context to respond to some of these issues. So uh, I think at this point, the catch-up strategies, availability of resources, providing support to learners that are currently going to definitely take examinations. These are some of the strategies that are currently in place. But if any other panelists would like to comment, you're welcome to take the floor, please.
Thanks, Fariel. There's one question here in the chat that asks, how will you respect the rights of those who want the vaccines or testing and those who do not? Will it be optional? Now, we haven't really gone much into the topic of vaccines and testing here because that was not the focus of this presentation. However, what I would love to say is that usually vaccination programs are not, they're usually guided by various principles, and we don't know what will happen if and when a vaccine becomes available. And usually this will be guided by ethical standards, and we would expect that that is followed whenever that situation arises. In terms of testing, what we have heard from most countries who have already started, at this stage of the pandemic, the testing is for people who have been exposed, those who are suspected of having disease, and for those who are confirmed with the disease and we need to clear them. So going forward, if and when the need arises for other people to be tested, we would expect that the relevant national authorities would provide enough information to guide the population about what the tests are, why they are doing tests, and provide some kind of means of for people to provide their consent to be tested. At this stage, from a CARF's perspective, we do not know of any situation or any reason why we would force people to take a test. But at the same time, CARFA is a regional organization and we do not directly test people. Our member states would need to send those samples to us. And so at this stage, we cannot say what will happen if additional testing will be carried out. But you can keep posted to our website where we provide regular updates on what is happening in terms of testing protocols from a CARFA's perspective and any guidance that we provide to our member states. Thank you.
Fariel, thank you, Stephanie. Fariel, just to share, if we may invite Dr. Bristol from CARICOM to share on some of the guidelines that she had also indicated that CARICOM will be working along some guidelines. I think with your leadership, if we could have that now. Yes.
Thanks for that, Latoya, and thanks for the opportunity, Fariel. And colleagues, good morning. So yes, the CARICOM Secretariat, in collaboration with our regional network of planning officers, very much aware of the complexity of the issues around reopening school. And today I have been sitting and I'm watching and I'm paying close attention. So we are going to be working with our regional planning officers. These are senior planning officers from all the member states in the region to develop guidelines to govern and support the reopening of schools. And of course, when we think about school reopening, we're not just thinking about policy, and infrastructural requirements, but critically, we're also going to be thinking about pedagogical implications for reopening schools. And of course, along with that, the psychosocial realities. I note in the chat that there's a lot of discussion right now around the pedagogical implications, and certainly more work needs to take place within our member states around those discussions, because whether we are using a blended classroom, a flipped classroom approach, whatever the realities are around how to provide for continuity of learning in a quality way, paying particular attention to issues around assessment also needs to be given center of place when we think about reopening. So while I know the primacy is around what are the infrastructure requirements, how do we ensure the public health issues and safety for our students, the other implication will be around pedagogical implications along with the policy imperatives. I think our colleague Suzanne from Curacao recognized that lack with Curacao, and we certainly within the guidelines that we'll be developing will be speaking to those issues as we work. So the fantastic thing about CARICOM collaborating with UNESCO on this on these webinars is that we're taking those practices and those lessons learned, and we're certainly going to be working to develop regional guidelines that are context specific. But I need to also put the caveat in place that while we develop regional generic guidelines, whether they operate at the international level or the regional level, it's always important to recognize that member states will be required to engage in consultations and conversations with their particular stakeholders to ensure that issues of equity, issues of access, issues of relevance, issues of participation, issues of quality are addressed as we go along the road to reopening, recognizing that reopening does not mean return to normal, given that we will be required to live with COVID-19 for quite a while. The opportunity is that it gives us the chance to ensure that we are developing more enhanced and creative pedagogical practices to support quality learning within the region.
Absolutely. I mean, that was very articulate and on the spot. So thank you very much, Dr. Laurette Bristol. I would also like to mention that I understand that CARICOM is also continuing to work with education planners and having a workshop with the UNESCO Institute of Educational Planning based in Paris, perhaps in the next few days to really take on a hands-on approach to help countries develop roadmaps at national level. So there is a lot of work that is going on. And I would really like to thank all the participants, and I would like to, for your very interesting questions, and the panelists for their insightful sharing of lessons and promising practices from the region, but also globally. And I think some of the key messages that I'm hearing are, we need to plan together, but it's important that the ministries of education and the providers of education plan together, not just with amongst themselves, but with the communities, with the parents, to assure the readiness and comfort level of parents and families, because so that parents feel comfortable to send their learners, their children to school, and prepare well to ensure the health and well-being of the learners, but not just in terms of hygiene and the physical hygiene of the building, but also prepare to minimize losses to learning and put in place strategies that would enable learners to catch up with the losses that they have already been facing. I mean, in the Caribbean, I was speaking with some colleagues and partners, and in some countries, only 40% of the learners actually have access to online facilities, and they're working through, low-tech solutions and all. So when they come back to schools, it's going to be important to keep equity at the center, to also assure the site. I like very much that example where in the first 1 week, the schools really focused on the psychosocial well-being of the learners and teachers, So there should be that space when in the first, I would say not just the first 1 week, but I would say the first 1 or 2 weeks, there should be space to address this, the emotional aspects of, the COVID-19, so that there should be opportunities for learners, but also teachers and school educators to discuss amongst themselves, to share their experiences, but also to build that resilience to respond well, and prepare in case, I really want to say this, that we have to be fully prepared. What if there's a relapse? We need to be we need to be ready for any mishap, because some countries that opened too soon, they did experience relapse. And the voice of that young student that Dr. Stephanie shared with us, it was a very powerful voice. In the absence of a vaccine, we really need to, we should not be opening schools till those protocols are in place, till the measures are being fully implemented, to assure the safety and well-being of all learners. So, and especially those at a higher risk, and the vulnerable ones. So this has been very insightful. This is the beginning of a dialogue. We will continue this dialogue on reopening school. The materials are going to be available on the UNESCO website, as well as we will also share, of course, with our national counterparts. But at the UNESCO Kingston website, we are going to post all the presentations and the resources that have been referred to during the seminar. And we also invite you to save the date for our next seminar on the 2nd of June. We are going to be looking at gender aspects of COVID-19. So please do save this date. This is again in collaboration with CARICOM and UNESCO. The next webinar will focus on gender aspects of COVID-19 on education. So please do, we will share the information with you as we move along. So thank you very much, everyone. I think the time has come to wrap up. And if there's any last word from the panelists, the floor is yours. We have 2 minutes more before we wrap up. So would the panelists like to say anything? Final words? Where is our hope? Some words of hope before we wrap up.
The hope is that we are resilient people. We have overcome many, many challenges, and it is to see opportunity even in COVID and beyond. So as a Caribbean people, we smile through the hardships, we pull our resources together, we look inward for expertise because they're there, and then we move along with the best interest of our students at heart.
Yes, for me too. I think the period gives us the opportunity to focus on the things that are really important. And that's what we're going to do. I totally agree with Fiona.
Thank you.
And I'd love to say that the Caribbean as a region is blessed with some of the greatest public health expertise among small island developing states. And we've got a very strong regional coordinating mechanism that has been leading the response to this COVID-19 pandemic. And we continue to support not just the health sector, but all the other sectors. And we believe that there is a ray of hope. And as we continue to work together, we pull on the strengths of our expertise across this region, and we will continue to fight to protect the lives and our human resources and our people across the Caribbean region.
Thank you so much. Lanchi and Latoya?
Yeah, if there's any message that I would like to pass on, I think although the COVID-19 crisis is very unfortunate, but it's also a chance for us to rethink about a lot of things, about the idea of education, the definition of education, and if there is any other way that we can better prepare ourselves for any potential crisis. Hopefully they will never happen, but once they happen, I do hope that we do hope, I think we all do hope that with this experiences and lessons learned from COVID-19 will be stronger to confront anything that will happen to us. So
Yes. Thank you. Thank you to Farial. I just want to share that in the midst of it all, there is a silver lining, a very bright silver lining in the midst of it all, that this is an opportunity for us to rethink and to shift, have the shifts that we have always been dreaming about and thinking about in education. Shifts around screening and assessment. I saw those coming out about how we assess, around curriculum, you know, around what are the most important things that we have to prioritize around teacher readiness, around financial stability of our students, safety, all those different aspects, bringing in the parents and the communities, stronger support systems. This is an opportunity to rethink and reshift and shift how we operate within the educational platform. Thank you.
On these words of hope, we thank you all, and we look forward to working together hand in hand with health and other sectors. And thank you everyone for a very interesting and useful and timely webinar. We appreciate all your inputs. Thank you.
Thank you very much.
Be well and stay safe and healthy.
Thank you. The same to you. Okay, bye-bye.
Bye-bye.
Bye.
Thank you so much, panelists. Thank you, Orialc team, Paula and
Ariel, do you want to wait? We still have some attendees in the room.
Yes, yes.
Wait until everybody's gone.
Thank you, everyone.
Yes.
Nice to thank each other and appreciate, and I'm sure they'll be happy also.